Welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer's Speaks. I'm thrilled you can join us today. We're going to have a wonderful conversation and learn about the GUIDE program through CMS, which is the Center for Medicare and Medicaid Services, that's going to focus on dementia care. They just rolled out this year. It's very exciting. But before I introduce you to our guest today, I always like to give a couple of shout outs. So one, I just want to encourage people to go to alzheimersspeaks.com because we have tons of free educational resources. You can listen, you can watch, you can download, you can read. There's all kinds of things. So please go to alzheimersspeaks.com and just click on our free educational tab. You can also find out about our book, Betty the Bald Chicken, Lessons in How to Care, which is great for all ages and all stages of life. You can also go to our sister company, Dementia Map, at dementiamap.com. It is a global resource directory where you can search over 150 categories. You can learn about terms through our glossary. You can read amazing articles and also check out events on our calendar as well. And it's free. You don't have to give us any of your personal information. So we're never going to hound you, and you don't have to worry about thinking about another password or getting hacked and scammed by us as well. And last, I just want to give a shout out to Twiddle. If you're not familiar with Twiddle, Twiddle is a fantastic company that has sensory products, and it works wonderful for people with dementia, but it can work for people living with autism and any type of sensory issues that they might have. They have a variety of different muffs that have different things to play with, kind of fidget with, but they're soft, they're warm, they're washable, they're comfortable, and they're portable. So that works really well. They also have a product called Adapt a Wrap, which is a clothing product where if you have someone that has limited mobility and raising their arms and getting a shirt over their head is difficult, this will alleviate all of that because everything goes on from the front and seals in the back, or maybe you have someone who disrobes. Please visit their website. It's the number 4 and then Twiddles plural.com and put in AS25 and you get a 25% discount. So let's go meet our guest today. Well, Marty, I'm so excited to have you on the show. We've been talking back and forth for a while, and the conversation today is near and dear to my heart since my mom lived with dementia for 30 years. And I know you're going through it yourself right now. So before we kind of dive into the GUIDE program itself, would you please introduce yourself to our audience as well as your company too?
Sure, absolutely. Thanks, Lori, and thank you so much for having me. I'm Marty Agather, and I am with Embrace Prevention Care. I'm responsible for sales and marketing for Embrace. And Embrace is a healthcare company that provides additional preventive care to older adults to keep them healthy and out of the hospital. We do that by convincing them that the doctors don't keep them healthy, that they have to work themselves to stay healthy. And what I guess is the genesis of our talk today is the fact that Embrace is one of 96 organizations that have been allowed to provide GUIDE services as what's called as existing services. So we are providing GUIDE care services today to patients. And there are well, we'll get into this later, but there are also another 300 that will be providing services in a year from now, in July of 2025.
Well, that's exciting. It's nice to see the change. I was hoping there'd be a lot more on board by now, but everything's at its own pace, and there's a reason for it.
That's
There's
correct.
lessons to be learned with all this. Now, again, before we dive into guide, I always ask every one of my guests if they've been personally touched by dementia, and I know you've shared with me you're going through the thick of it right now. But if you don't mind giving our audience a little background, I think it's just nice when they know that you know.
Absolutely. So, even before at a higher level, what has been the driving factor of our company is the fact that, we have all had parents who, as they aged, had complex health conditions. Myself and one of our directors, we both have mothers who are experiencing dementia. My mom has been living with dementia for probably the last 3 to 4 years. About 3 years ago, we realized that my father had recently passed away. We realized that my mother was unable to continue to live on her own. So for the first year, one of her children or grandchildren traveled to Florida to her home so that we could stay with her 24/7. As we got into year 2 of that, we realized that was not, a sustainable model. And so we had discussions internally between my siblings and myself about where should mom go. And there were 3 options, with my younger brother in North Carolina, with my younger sister in Chicago, or with me here in Minneapolis. And for a number of reasons, her coming to Minneapolis made the most sense. So we brought her up 2 years ago and got her a place in an assisted living facility near my home. That was all going very well. She was doing wonderfully. We did not have some of the challenges that other people have with their parent or their loved one resisting going in. I mean, my mother was, for a while she said, I want to stay in my home, and we finally, helped her understand why that wasn't possible. But because she was involved in selecting the assisted living facility, and we visited it a number of times, it began to feel like home, and she made the decision herself to select that facility. And I think that's a key message that everyone should take to heart, and that is, our older adults still have agency. Even in the midst of this terrible disease, they still have agency, and we should work with them when possible to help them be part of any decision. So we moved her in, and everything was going well up until earlier this summer. And our family is fortunate enough to have a long time family cabin, a 3-season cabin. It's not winterized in any way, shape, or form, in northern Minnesota. And so my mother and father would always spend their summers up there, and we have continued to do that with my mom. She was with my sister and her husband up there, and she got weak. And so they decided to bring her back and let her stay in her apartment for a few days while they went back to Chicago to take care of some business. And while she was in her apartment, she fell at some point overnight. She was fully ambulatory at this point, fell and got trapped between the nightstand and the bed frame. And she laid on the floor for what, as far as we can see, was all night long. And when they came in to check on her to deliver her morning meds, they found her and called the emergency services, and they took her to the emergency room at the local hospital. I was obviously immediately notified, went over. That turned into a multi-day stay in the hospital. One of the things that they determined was that she had contracted COVID. And so we believe that that was the original source of her weakness and probably, resulted in the fall and has made recovery very difficult. She is in transition care right now, but she is not making the progress that we would hope. And so she is now being discharged due to Medicare rules from transition care. And we are scrambling to find skilled nursing because the facility only had shared rooms for skilled nursing. Thankfully, one has opened up in the last couple of days, and we are going to move her into a private skilled nursing room in that facility, hoping that she will get better and can resume living on the assisted living side where she has her apartment, but that is not guaranteed at this point.
Yeah, it is complicated. It is so complicated. And that COVID's thrown so many people for a loop because that whole healing process, it really, it just changes everything for sure. So sorry you're going through all of that, but you definitely understand the ins and outs and those tick modes of getting bumped out of the system. And then where do you go and how the heck do you get there?
That's right. It is complicated. And I would like to offer one more piece of advice, if I may. And that is, this is a little known fact, but if your loved one goes to the emergency department and is not admitted to the hospital out of the emergency room stay, that is 100% on you. That is not part of, and I may have the details a little bit scrambled here. Because a long time ago I wrote this up article on our website. But long story short, you really want to have your loved one admitted to the hospital after an emergency room visit because Medicare treats that completely differently, and most of those costs are covered. I believe there's still a copay for an emergency room service, even if you're admitted, but it's not the majority of the bill that you end up taking on personally. So a great thing to know and something to be aware of.
Well, and those bills are, they're just humongous. They just throw people for a loop with all of that stuff.
I think when we checked, so when she was being discharged from the hospital, we checked and they said, well, how are you going to get her back to her facility? And well, we can't put her in a car because she's bedbound. So I believe it was about $2,500 for the ambulance ride, about 6 miles.
Yep. It is crazy. It's absolutely nuts. Well, thanks for sharing that. That's a great
you're very
tip
welcome.
for people to know. So let's start out with what you feel like the environment for dementia care is, as a whole. I know I have my opinion.
Sure, absolutely. And I'm looking at it more sort of that we are in a position of transition. Today, unfortunately, dementia care, strike that, dementia itself is feared, and it is it's a diagnosis that nobody wants. And when I think the best analog we have to that is how cancer was looked at about 70 years ago. And if you got a cancer diagnosis 70 years ago, there wasn't really treatment. And there were some people that were working on things, but that was prior to understanding chemo and radiation. And so if you got a cancer diagnosis, it was essentially a death sentence. There was no known cure, and you had a very, very serious illness that was going to progress and ultimately end your life. And I believe that we are in the same place today with dementia. People are just deathly afraid of hearing that. And so there is a real resistance to even thinking about it or going to a physician to confirm whether or not you've got are in early stages of the disease. And in my mind, there are so many things now that are coming online to provide hope and to indicate that we have the ability to actually treat this disease, and we can't cure it, but we can slow the effects. And the whole idea is the earlier we can detect dementia and the more we can do will lengthen the quality time that the person suffering from dementia and their loved ones can spend together. And that is the ultimate goal. So there's a number of things, 3 that are going on right now that are driving this change in dementia care. Number 1, we know that lifestyle has a direct impact on dementia. And therefore, healthy lifestyle, food, diet, it's exercise, it's hydration, it's sleep. These things are critical to keeping your mental exercise, right? Conversations with people. All of those things are critical. So these wellness lifestyle approaches are great to slow the progression of the disease. The next big thing is medicines. There are 2 approved dementia medicines now and over 120 in development. And then the third big issue is we know now that additional care for dementia patients is effective and actually has positive impact. This was piloted through some pilots through the National Institutes of Health back in the 2015-17 timeframe, where a number of teaching academic hospital systems got involved in what ultimately became the precursor and the proof for the reason that GUIDE has been developed, but working with dementia patients in a virtual model had amazing positive benefits for those patients. And so those 3 things taken together, to me, signal that we are in a new era of dementia care. And that is why we believe that everyone who is at risk should determine as early as possible that they are in early stage dementia so that we can begin to take effective action to slow the progression of the disease.
And I agree and I disagree with some of that. And I'm
Sure.
just going to pop that in because this is always conversational on this show. I agree with the 3 factors all the way that you talked about. And what I would love to see with the lifestyle is really that push for social engagement, which I think is kind of picked up on your number 3, but is worded differently. But I think my mom lived 30 years because she was socially engaged. And when we are socially engaged, we are hopeful, we feel part of a community. I mean, it gets rid of our depression, we feel like we belong. And to me, again, and I'm no physician or researcher, but I have talked with thousands and thousands of people all around the world. And that piece of the puzzle has such a significant impact on people. And I know there's a few studies out there doing social prescription, which I think will fit in with, the GUIDE model really, really nicely. But I just think it's so important for people to not be fearful. And the only way to get rid of that fear is to develop comfortable platforms to have authentic conversations where people can laugh and cry and be happy and mad and share their stories, because all of those individual stories raise everybody together. It takes away that I'm not alone piece, which is massively huge and we hear over and over again. So I'm really excited about all of this. I think
Yeah.
all of these pieces together is really, really cool.
I agree with you wholeheartedly. Let me throw in one thing that as you spoke I wanted to share. Some of the research that we've been doing has indicated that two very important contributors to dementia decline are lack of hearing and eyesight problems. So please, please, please have your loved ones hearing tested, because as their hearing, if their hearing starts to degrade, that is such an impact on that socialization that you were just talking about. They can't follow. So we have been very proactive. If I can just add a little bit more to my personal story, we've been very proactive with my mother's hearing, and she's been having trouble. So at the audiologist at the last appointment, maybe 2 appointments ago, he said, you know what, you're at the point where you should upgrade the hearing aids. If she wasn't having this difficulty, I would say you could, because they're only 5, 6 years old, but the technology, like everything computer oriented, changes constantly. But what he did is, so he gave her an audio test and realized that it's not the fact that the hearing aids aren't effective. It's that her brain is starting to lose comprehension because it's not working fast enough for her to understand. She was losing about 40% of the conversation. Not because the hearing aids weren't working, but because her brain was slowing down. So again, make sure you have your loved ones hearing tested, because we want them to continue to be engaged in the world around them.
And I'm going to add on to that one, because what I hear from people living with dementia is, yeah, hearing is important, sight is important, but so often we're talking to somebody and they're not able to read our lips. They're not able to see our facial expressions. Yeah. And what people with dementia tell me all the time is, please look at me when you're talking to me, because I didn't know I was reading lips. I didn't know I was reading all these facial, impressions. And that helps me figure out what is being said and what is going on. And to me, that's a really huge, huge piece, because so often we're good at separating things and going, this is a problem and this is a problem. But they can still, till the day they die, they're taking in all of this multisensory stuff. And, families and physicians and professionals truly don't understand that. They don't understand the impact of that multisensory engagement and how important that is. Anyways, I don't think so. Not to the level that they need to.
Yeah, understood. Absolutely. Great point. Thank you.
That. So let's talk about treating dementia. You had mentioned, that there's a couple of drugs, but there's really no cure. Was there anything more that you wanted to add to that at all?
No. The two drugs are outrageously expensive. They're both focused on plaque in the brain, which is one of, not the only contributor to dementia. There are, at least a half a dozen, probably more than that, vascular dementia. But the one that's most aggressive, and I believe is the primary cause of Alzheimer's, is this plaque in the brain. And those medicines, again, they don't eliminate the plaque. They just slow its formation. So right now, again, the medicines are not a cure, but they are, $30,000 to $50,000 a year for the meds. So they are not a solution in many instances.
Yeah, and there's side effects that can be with those as well. The other thing, there's the new blood test everyone is pushing, to see if you
Yes.
Alzheimer's and stuff. And I will just mention, there's a lot of pushback from the public on that, going, what's that going to do to my insurance? Now, is that going to be an existing thing and I'm not going to be able to be covered, or I'm not, am I going to get my driver's license pulled? There's so many factors that no one's really talking about. How is that going to impact long term? And if we're looking at just approaching it from, a prescription thing, there's not a lot that's really doing anything major, in my opinion, out there. It's helpful to a point, but I also understand from a realistic factor, and again, I don't think this is taken into play and it's not talked about a lot, but I can't tell you one person, and really not one person that I know out of everybody I know around the world living with dementia who has not had their diagnosis change. So they start out with Alzheimer's, and then it's Lewy body, and then it's Parkinson's, and then it's MCI, and then it's, and so this is not a black and white deal here with all of this. And I think that's something that families need to be prepared for from their doctors as well, is that this is a baby disease. We're still learning all the twists and turns and defining it as we go. With that, but let's talk about the guide, because tell us what are the goals of the program? Because like I said, when I heard about it, I was like so excited, because it's like finally a help from the doctors. Because one of the things that people say constantly is, I go to the doctor, I get a diagnosis, I get a prescription, I get another appointment, and if I'm lucky, I might get the number to the Alzheimer's Association, and that's like it. And so they're out on Google, they don't know about support groups. They don't know about all these beautiful programs that are out there. And so I was very excited, because I think doctors knowing these other resources, and being able to tap into this is actually going to change how the diagnosis is even given to the families, because so many of them get that diagnosis, and I'm sure you understand this. They go out to the car and they cry sometimes for a couple hours before they can even drive home, because they feel so lost. So I have great hopes on the guide program.
Sure. Well, we all do. At the very highest level, GUIDE is an acronym for Guiding an Improved Dementia Experience. So that's the concept, and the overarching impetus, as I said a little bit earlier, for this was the success that they had in these pilot programs through the National Institutes of Health, and at the highest level. It's an 8-year program that has been, it's funded, and the intent is to capture all kinds of data. And I can tell you there is a lot of data that we are required to track, so that they can prove that this program is effective. And so it's actually, the program itself is out of the Center for Medicare and Medicaid, so that's CMS or Medicare as we call it, but the Center for Medicare and Medicaid Innovation Group. So they are sort of the think tank that is trying for Medicare and Medicaid to identify best practices and new programs. So they have lots of programs that come out, and this is the latest and greatest for dementia care.
So you said 8 years.
Yeah.
And I know that from my very minimal knowledge, it sounded like anybody who wanted to participate in this, and this is people who are already hooked up with getting, payments through CMS, had to apply by the first of this year.
You're talking about the application for participating providers.
Yeah.
Yes,
yeah.
Correct.
Go ahead.
Yeah, no, you finish, and then I can flesh out the details.
And that, kind of kicked the barn doors open in July 1st for those who were approved with this. So, let's talk about the goals of the program. One is data, but
Yeah.
what kind of data are they looking at, and what type of help are they hoping to offer families?
Sure. Well, without going into the dirty detail, there are over 105 data elements that we are supposed to capture about the dyad. The dyad is the fancy language for the caregiver patient combination. So we have to have information not only about the patient, but also about the caregiver themselves, because one of the, so the three goals that you asked about is number one, improved quality of life for the patient. Okay, so that's the first goal. The second goal is to reduce the level of burden on the caregivers, because CMS understands that the caregiver is doing a lot of this work without any compensation, but if while they do that work, it reduces the ultimate cost to Medicare because that patient isn't in skilled nursing. And then the third goal is to keep the patient at home for as long as possible and keep them out of skilled nursing. So the three goals, again, improved quality of life for the patient, reduced burden on caregiver, and keep the patient at home as long as possible.
And everybody says they want to stay home. Yeah. I mean, goes back to my real estate days. You're going to take me out feet first. I'm not going any place with that. And that still really, really hasn't changed a whole heck of a lot. What kind of healthcare providers can, provide this offering?
Sure. So you were starting to get there, and I mentioned the numbers before. But the official terminology for a provider who can offer guide is they are called a participating provider. And in order to be a participating provider, you had to apply by the end of January of this year. And then all of the applications were reviewed, and on or about the 1st of May, applicants were notified whether they had been accepted into the program or not. Mm-hmm. And there are actually two different levels of how to be accepted into the program. So you could be an existing program, which means that you are treating dementia patients now, and that you were doing a majority of the care delivery services that we'll talk about at some point already. So you're not trying to build this from scratch. You've got most of the work already done. And if you qualified as an existing program, then you could start treating patients as of July 1st of 2024. If you didn't qualify by, had done a majority of the care delivery already, or you weren't actively treating dementia patients to the level that Medicare wanted you to, but you committed to being ready to do that by next year, then you could be in what they call the new program. And the new program is for people who need more time to build out their set of services. And so those organizations start on July the 1st of next year, 2025.
Okay. Well, that's understandable. I mean, this is a big to-do. So there's a lot of wheels that got to click together to make this machine roll, for sure.
That's right.
On that. So, you said there was like 90 some people companies that have been approved, in about
correct.
300 more.
Yeah, thank you. Yeah, I neglected to put that into my answer to your question. So yeah, there are 96 organizations that are approved as existing programs. And that varies by state. And they range, everywhere from large hospital systems down to small practices. And I think that some of that was intentional because Medicare wants to see how these programs are working and what, are there any trends to who does it better? So.
Yep. Well, yeah, because being able to pass that along to the others, if it can reduce the work to set up and streamline things, that makes a ton of sense, to be able to get that out and going. I want to just do a little break here. And for those of you who might just be popping in right now, we have been talking with Marty Agather from the Embrace Prevention Care Company about the guide program for dementia. And their website is embracepreventioncare.com. And if you want to go right to kind of this program and their dementia care, do a / dementia care on that. And their email is info@embracepreventioncare.com. You can also call them as well at 302-329-8452.
That phone number is to our care delivery team, and so they can give you some information on that. Now, at present, we are only working with patients in Delaware and Pennsylvania. So we do not have operations outside those states at this point. We're working on developing relationships in a number of additional states as well.
Okay, wonderful. Well, that's fantastic. I also, before we go back to our questionings, I want to just give a plug for Q for Good. Many of you out there have websites and probably have struggled like I have trying to find a good webmaster. These guys are excellent. They communicate, they follow up, they reduce your stress, they design beautifully. And, if you want to reach out to them, it's just qforgood.com, mention my name, and you'll get a 10% discount. But I know for me, I struggle with getting a good webmaster. And so I just love to plug them because I really, truly do believe in them. So let's get back to talking about the guide program. Let's say I want to see if I qualify for this. What is my next step? How do I find a physician? What do I do?
Sure. So, unfortunately, right now it's not very well organized at the guide level. So while the name of a provider in your state is available on Medicare's website, and I've got that we can get that in the show notes, I suppose, Lori. It's at the bottom of the piece I sent over to you, but it doesn't really tell you what their area of operation is, and this is one of the challenges of the program. It's actually beneficial, but it's hard to say how each entity, each participating provider has taken this up. So let's before we get to the dirty details, let's talk at a high level. You can be referred into a program by your primary care physician or your neurological specialist. So if they have knowledge of the program, they can refer you directly to the participating provider who is required to work with you. Okay, it doesn't mean they're required to put you in the program, but they are required to work with you, and there's a number of reasons why that is. But what's important to know so that's number one. Number two, you could also, if you find out about a program, so you look on the Medicare website and you see that Dr. Smith in New York City is providing guide services. You can call. You don't need a referral from your physician to go. So you can actually call Dr. Smith and say, I understand you're a participating provider in the guide program. We'd like to see if we qualify.
Okay. And I would imagine to qualify, they'd still probably need a referral within network and all of that kind of stuff, the way insurance works.
Yeah. However, so that brings up, eligibility requirements. So let's talk a little bit about that. So the number one eligibility requirement is that you've got to be on Medicare Part A and Part B. So for people who don't live in the Medicare world day to day, and it's very confusing, trust me, I'm in the business and I can't hardly get it right. Medicare Part A and Part B is what we call traditional Medicare. So that is not supplied by an insurance company like Blue Cross or Humana. Medicare, traditional Medicare comes directly from the government. So you cannot be, unfortunately, in a Medicare Advantage program through Blue Cross. And we can get into why that is, but there's a couple other exclusions I want to get to as well. So in order to qualify for the program, if you're in traditional Medicare, you must have a dementia diagnosis. So that's the first piece. The second piece is there's a number of exclusions that are not included. So number one is if you are in a PACE program. PACE is the program for all-inclusive care for the elderly. So that is a program, I believe it's state-run. It is state-run. And if you're in a PACE program, if your loved one is in a PACE program, you will know that. The second one is you cannot be in a skilled nursing facility, because at that point, the third goal has already been eliminated. And then the other exclusion is for patients who are in hospice, because obviously at that point, we are pretty much to the end of the journey. So so those are the exclusions. And then of course the big one is the exclusion for Medicare Advantage. And I can explain a little bit about why Medicare Advantage is excluded. It's kind of complicated, but essentially every patient in a Medicare Advantage program is actually the vast majority of their care is being paid for by the government from Medicare already, even though you're getting your care from Blue Cross. Your Medicare is actually paying the bill, and it's a complicated explanation of why that is and how it works, and we don't need to go there. But basically, Medicare's position on this is, well, we're already paying for the patient once through the Medicare Advantage program, so we're not going to pay this additional care. That's up to Medicare Advantage. Now, the good news is we believe that as the efficacy of this program is shown, as we show improved results for these patients, a slowing of the progression of the disease, we believe that Medicare Advantage companies are going to want to provide similar care to guide to their patients. So, what can you do to prepare? My recommendation right now is if you're on traditional Medicare, stay on it. If you're on a Medicare Advantage program, we know you're not eligible, but come enrollment period, which starts in October, you can switch from your existing Medicare Advantage program to Medicare so that you can enroll in Guide as soon as you enter the program. And Lori, we did talk a little bit about this a month or so ago when the last time we spoke, and I did check. There are no pre-existing conditions in traditional Medicare. Just as the only requirement is that you get it done between October and December 31 and get switched over to traditional Medicare.
Oh, that's good because I had heard that if you had dementia, they wouldn't accept you
No,
flipping
so
over.
yeah, so
So
that's
thank you for checking on that.
you
Appreciate
got
it.
it.
Wonderful. Now, one of the other things that guide covers is the caregiver, but do they have to be on Medicare, or because there's a lot of kids or
Right.
spouses that are younger, that are caring for somebody who may or may not be on Medicare themselves. What's the qualification there and eligibility?
Sure. So at first it's got to be an unpaid caregiver.
Mm-hmm.
And I can't speak with a whole lot of clarity to who is going to be identified as a qualifying caregiver. But let's roll back just for a second. So, because we forgot to talk about the primary benefit of guide, and that is all of this additional care, which we'll get to in a minute, all of this additional care is provided to the person living with Alzheimer's and the caregiver, if they qualify, at no additional charge. There are no copays, there are no deductibles. This is literally additional care at no additional cost. So that's a wonderful, wonderful benefit. And if the caregiver qualifies, then there is an additional benefit to the caregiver for what we call respite care. And respite care is when the caregiver needs a break and, has someone come into the home or actually has the patient go to adult daycare or potentially an overnight or multi-day overnight stay at a facility. And in the event that the caregiver qualifies for this benefit, that will be paid by Medicare up to $2,500 in expenses each year.
So that's wonderful. I mean, that's one of the things people are kind of drowning out there right now, looking for respite. And, as we had talked offline, so many of our adult days, went out of business during
Yeah.
COVID. It haven't popped back yet.
It is very difficult in some parts of the country to find respite.
Mhm.
And that's one of our responsibilities. Well, the participating provider's responsibilities is to find, because that's one of the required services that we have to deliver, is to find respite care companies. So that's the beauty of the program, is all of these resources are required to be found by the participating providers and their service providers. So that's great. But it is, you are absolutely correct. Finding qualified respite providers is a real challenge in some parts of the country.
Yeah. And as we had talked before too, some of it is that they've shortened their hours, and a lot of people don't think that's really not going to help me. I'm going to rush to get them there, and by the time I
Yeah.
turn around and go do my grocery shopping or go get my nails done or go see a ball game or whatever, I have to rush back or maybe cut it short to pick them up, because a lot of them, like I said, the hours have just cut back on that. So hopefully that's something that will change. And
Well, the good news is that I believe as the word of this program gets out, there are going to be new businesses, or existing businesses will expand because they realize the opportunity of all the added demand, because families that are in the program now have the ability to finance respite.
yeah, because a lot of times they just can't afford it.